Group therapy is a style of mental health treatment where you have a group of individuals that all come together that's led by a trained mental health therapist. The groups typically are focused on either one presenting problem or diagnosis, and sometimes will include specific ages or genders as well. Group therapy is effective because it has the advantage of individuals gaining support, validation, and feedback from a group of their peers, as well as a mental health therapist. It tends to improve people's ability to openly communicate, as well as actively listen to others, as well as learn coping skills and more about whatever they need, and they get to learn from more than just one person. It is not uncommon for an individual that's in group therapy to also be working with somebody in individual therapy, sometimes also family therapy. Sometimes group therapy is really seen as a supplement to those other treatments, but there are times where group therapy is sufficient for an individual. It varies quite a bit, especially depending on the specialists at each clinic. I think there's probably group therapy for about anything you can think of, every age range. If you're talking about the real small children, a lot of times then their parents would be involved. Typically you'd see it once kids are in school, all the way up through, adulthood. But you see groups based on anger management, anxiety and depression, emotional regulation issues. Sometimes they're more focused on a theoretical perspective, such as cognitive behavioral therapy, where it's more skill-based. So it really varies quite a bit. Some of the fears that I hear, in particular with working with children or adolescents, is that they're afraid that they'll know other people in the group, that confidentiality will be an issue. Sometimes it's concerned that they'll be judged because whatever mental health issue they have, maybe they haven't shared that with a lot of people. It's been a secret, I guess, within the family. And so obviously when you come to group therapy, you're already acknowledging that there's a struggle, and then this disclosure in the group is frightening for people before they actually do it. I think parents often worry that their kids will learn things from the group that could make their situation worse. Usually what I find in that situation is that kids or teens especially already have these struggles, and because of the group process they're starting to talk about it more, so we're actually able to deal with it.